Our speaker is a native of Chicago, Illinois, and the daughter of two distinguished physicians. Her mother, Dr. Beatrix Hamburg, holds the distinctions of being the first African-American woman to attend Vassar College and the first to earn the MD degree from the Yale University School of Medicine. Her father, Dr. David Hamburg, is a noted physician, a champion of public health, and a former president of both the Institute of Medicine and the Carnegie Foundation of New York City. We can clearly see that the seeds for her future were planted and nurtured very early. You will soon learn from the commissioner her deep connections to Meharry Medical College. Our speaker earned her undergraduate degree at Radcliffe College of Harvard University and the MD degree from Harvard Medical School in 1983. After a residency training in internal medicine at what is now known as New York Presbyterian Weill Cornell Medical Center, she conducted groundbreaking neuroscience research at the prestigious Rockefeller University in New York and the National Institute of Mental Health. She focused on AIDS research as an assistant director of the National Institute on Allergy and Infectious Diseases of the NIH. Thereafter, she entered the field of public health. In 1991, when the first African-American mayor of New York City, Mayor David Dinkins, appointed her acting commissioner of the New York City Department of Health, the largest public health department in the nation. She soon became commissioner the following year, and her tenure at the health department lasted an impressive 6 years. During that time, she developed a model tuberculosis control program that resulted in steep drops in drug-resistant strains of the disease ravaging New York City at that time. Her other accomplishments include improving and expanding services for women and children, a needle exchange program to reduce HIV transmission among IV drug users in New York City, and starting the first public health bioterrorism defense program in the nation. Her career moved from local to national service in 1997, when she became Assistant Secretary for Planning and Evaluation in the U.S. Department of Health and Human Services during the presidency of President Clinton. She was also elected as one of the youngest ever members of the Institute of Medicine in 1997. The interest in bioterrorism led her to becoming a founding vice president for biological programs at the Nuclear Threat Initiative, which is dedicated to reducing the threat to public safety from nuclear, chemical, and biological weapons. Now, our speaker came into her current position in 2009 when the 44th President of the United States, President Barack H. Obama, nominated her to become the 41st Commissioner of the Food and Drug Administration. Over the period of a scant 3 years, our speaker has provided stellar leadership for 3 groundbreaking and far-reaching public health initiatives: the Family Smoking Prevention and Tobacco Control Act, the Food Safety Modernization Act of 2011, and a system for thoroughly reviewing and evaluating medical devices submitted to the FDA for approval. Ladies and gentlemen, our speaker is positioning the Food and Drug Administration to be a global leader in addressing today's public health challenges. So please join me in welcoming an outstanding physician, public health advocate, and the 41st Commissioner of the U.S. Food and Drug Administration, the Honorable Margaret A. Hamburg. Dr. Hamburg.
Thank you very much. That's really not necessary. Thank you. Well, let me begin by thanking you, President Riley, for that very gracious introduction and for the wonderful privilege of delivering this year's Meharry Medical College convocation address. Let me also offer congratulations to all the distinguished faculty and alumni that are here with us, board members, today's honorees and award recipients, and of course, all of the students. This is an inspiring occasion. Today is Meharry Medical College's 137th convocation, marking the opening of a new academic year and important next chapters in so many lives. Convocations are a time for renewal and looking forward, a time for the entire medical school to assemble as a community, and a time for celebrating Meharry's unique contributions to education, to medicine and public health, and to human dignity, accomplishment, and caring. So speaking to you today is truly an honor, and I'm delighted to be here. But before talking about the great traditions at Meharry and the important years that are before you, I want to say a few words about the tragic outbreak of meningitis that's currently going on. As many of you know, the first illnesses were discovered right here in Nashville. I commend the Tennessee Department of Health for their leadership and quick response, identifying the cluster of cases and alerting CDC and the FDA. This tragedy now includes 205 cases and 15 deaths, including 53 cases and 6 deaths here in Tennessee. Our hearts go out to the patients and their families exposed to this terrible contamination. FDA has been working closely with CDC in the states, including Tennessee, to identify the source and cause of this devastating outbreak and to limit further risk. We've been in close communication with Tennessee public health officials from the start, and that cooperation and partnership has continued as we further investigate the situation. As students and young doctors embarking on a career in medicine, you will no doubt face your own medical crises, big and small. And I know that with the training you will receive here, it will prepare you for whatever you are faced with. And frankly, we're counting on you. This is a remarkable place. Meharry Medical College has graduated generation after generation of healthcare professionals, mostly, but not exclusively, African Americans, who have taken the medical skills and passion they found here to communities whose medical needs were often as invisible to most of society as Ralph Ellison's famous literary creation, The Invisible Man. One of the doctors who graduated from Meharry Medical College with that skill and passion was my own maternal grandfather, Dr. Minor Francis McCleary. I feel confident that my grandfather is somehow part of this convocation today, as proud as he can be, though perhaps just a little surprised. And although he graduated in 1901, it's never too late for me to say thank you to Meharry for the doors of opportunity you opened for him, doors in turn that eventually allowed me to become a clinician, researcher, commissioner of the New York City Department of Health, an assistant secretary of the Department of Health and Human Services, and now commissioner of the Food and Drug Administration. Unfortunately, I did not know my grandfather. In fact, he died when my mother was a little girl. We missed many shared moments and celebrations, so it's especially moving to know that I will soon be receiving an honorary degree from the same esteemed institution that granted him his medical degree. Through his training here at Meharry, my grandfather embarked on a professional path in medicine that is now a living legacy for me and my family. As you heard, my mother followed in her father's career footsteps, attending Yale Medical School as the first African-American woman to do so. And then it was my turn. While I was in college, there was in fact a brief time when I thought about other careers. My parents now call that the period when I was drifting. But I found myself drawn back into medicine and continued the family tradition that my grandfather started here at Meharry. I enrolled in medical school and learned many important lessons, some that went well beyond diagnosing diseases and treating patients. But sometimes the most important lessons come from the richness of family, culture, and tradition, including this old African-American spiritual. Don't let nobody turn you around. Turn you around. Don't let nobody turn you around. Wait until your change comes. Inspired by my grandfather's example, not being turned around is what I've tried to do my entire career. But more importantly, not being turned around is what Meharry Medical College has done for its entire history. Since 1876, when you started with 11 students, 2 faculty, and classes in a church basement, you have never let anyone turn you around. Instead, you stood firm, built a world-class medical institution, and waited for justice and change to come. But for Meharry, waiting for change never meant standing passively on the sidelines. It meant waiting for change to catch up with the example of professionalism, hard work, excellence, compassion, and tolerance you set for our nation to learn from and to follow. Today, Meharry stands as one of the finest academic health centers in the country, training doctors, dentists, nurses, biomedical scientists, and public health specialists, while never abandoning your core mission of primary care, treating underserved populations, and eliminating health disparities. In addition, you're an increasingly powerful voice and leader in health policy analysis and research, something of growing importance in an era of healthcare reform. The Center for Health Policy at Meharry Medical College is training doctoral students in economics, sociology, and political science, and helping to build the intellectual base and research capacity America needs to develop meaningful and cost-effective healthcare policies for the 21st century. As the head of the FDA, I talk frequently about the importance of creating a comprehensive, integrated strategy that engages the full biomedical ecosystem to promote and protect health. This extraordinary medical college, in all of its aspects and activities, represents a critical part of that ecosystem and a much-needed partner for the FDA. Working together, we can foster new knowledge and ideas, new regulatory models, and new advocacy to ensure that advances in science and technology today actually translate into real-world medical products and interventions that people need and can count on, and that we have a health system that supports vital, timely access to health care, encourages prevention, and that strives to end the shame of health disparities. The FDA is working on components of all of these issues. Also, we've recently established an Office of Minority Health, which offers exciting new opportunities to address minority health and health disparities through coordinated leadership on regulatory actions and decision-making within the FDA, and through partnerships across sectors, disciplines, and organizations. Of note, through the Office of Minority Health, we've entered into several memoranda of understanding with academic health centers that have expertise in health disparities, including one with Meharry Medical College relating to HIV susceptibility among minority women. These MOUs are intended to help matriculate more students into health sciences, foster collaborative research, engage FDA staff with faculty and teaching, and expand FDA's knowledge base about the intersection of regulatory science and health disparities. Our work together matters. As a science-based regulatory agency with a public health mission, FDA plays a unique and essential role in assessing the safety and efficacy of the products that come before us and in helping to support the kind of innovation needed to get newer, safer, and better products to people. We need good science that ensures that this occurs, and we need to be sure that these efforts include an understanding of the impact of these drugs and devices on all populations. Good science must also take into account the many factors that can contribute to disease and impair the safety and effectiveness of treatments. And good science must be ethical, respectful, and must be in the service of humanity. That is the kind of science that I insist the FDA stand for, and it must always be the kind of science that our nation stands for. Something else that we as a nation must stand for is ending the disgrace of leaving tens of millions of Americans with health insurance. Probably no medical institution in the country has done more to help the medically underserved than Meharry Medical College. The founding vision of this school is that all citizens, no matter what their race and ethnicity or income level, deserve the dignity and security of knowing that their health care needs will not be forgotten or ignored. You have stayed true to that vision by focusing on primary care for underserved populations, teaching smart prevention strategies, and being a model for how a social conscience and a great academic health center can combine to knock down traditional barriers to high-quality care in poor communities. But the problem of the uninsured is national in scope and can only be solved with a national strategy. And that is exactly what the Patient Protection and Affordable Care Act is designed to provide. Not only will it enable coverage for millions of uninsured Americans, it will improve the quality of health care, put a new emphasis on prevention, and will end much of the cost shifting to institutions like Meharry as the provider of last resort. There are also important provisions related to healthcare education and workforce training. A national commission to review the current state of our healthcare workforce and projected workforce needs, as well as new support for workforce training in family and geriatric medicine, nursing, dental care, psychology and social work, and cultural competency. And under the ACA, the Federal Student Loan Program will be modified to provide greater support for nursing students and for MDs who intend to specialize in primary care, along with a new repayment program for pediatric subspecialties who work in underserved areas with underserved populations or where there's a shortage of health professionals. For these reasons and others, the Affordable Care Act is critically important to building a better, more equitable health care and public health system in our nation, including the education and training of our future doctors, dentists, nurses, and other health professionals. But education is about more than better national policies, increased funding, and first-rate training at Meharry and other great medical schools. It is also about who we are as individuals. Dr. Martin Luther King said, "The function of education is to teach one to think intensively and to think critically. Intelligence plus character. That is the goal of true education." And if life has taught me anything, it has taught me that Dr. King was right. My experiences as a medical student and during my residency training taught me so many things beyond the classroom. To be humble, resilient, and also optimistic. They taught me that I was capable of stepping up and taking responsibility. They taught me to ask questions and to trust my instincts. They taught me to listen, to think through problems, and to defend my decisions. And perhaps most important, they taught me that no matter how difficult the night, and believe me, I've had many sleepless, anxious nights, that morning always comes. In other words, I learned that I would survive, even thrive. Those skills and perspectives have served me well in everything that I've done since, especially in my current job. So why do I tell you this? In part to reassure you, no matter what your field of study or in practice, you too will survive and thrive. But also to make the point that education, especially medical education, is not just about studying hard, getting good grades, and impressing your attendings with your sharp minds and impressive clinical skills. It's also about character and the qualities that build character: endurance, persistence, resilience, self-reliance, self-control, facing up to failures, getting back up after you're knocked down, and an intangible quality best summed up by the word grit. Earlier this year, Paul Tough published a book entitled How Children Succeed: Grit, Curiosity, and the Hidden Power of Character. I have to confess that I haven't read this book cover to cover, but the book underscores a crucial insight, one that is perhaps a bit contrarian to some of today's thinking with our societal emphasis on test scores and grades. Being smart matters, but so does having goals, working hard, and the ability to face up to difficult challenges with courage, resilience, and grit. In the crucible of life, these may prove the better measure of future success than sheer brain power. And that is why I think there's real hope in this message. Grit, curiosity, self-reliance, and optimism are not written into our DNA. They do not belong to any one group or class. They are not out of the reach of any child. But we need to make character building part of our message to children growing up in both poor and affluent communities alike. It must be part of what we seek and reward in our students, our educators, and our leaders. and it certainly must be part of what we value and learn as members of the medical community. Let me close with this thought. As I look around this room, I see the power of character. You are taking on one of the most difficult academic challenges, excelling in medicine and science. If you haven't had stressful, what have I gotten myself into moments yet, I promise you that you will. But I also promise that by choosing Meharry Medical College as the place to pursue your medical and public health careers, you have made character and commitment the driving force behind your success. You didn't have to choose a medical school with a rich history of social conscience, but you did. You didn't have to choose a medical school committed to serving poor communities and ending health disparities, but you did. And you didn't have to choose a medical school that looks for students that nobody can turn around, but you did, because that is who you are. And for that, you have my thanks, my deepest admiration, and my very best wishes for this new academic year here at Meharry Medical College. Thank you.